Hello everyone, this is Dr. Sriranga, interventional cardiologist. People will be curious to know what happens inside the cath lab, how it is felt inside the cath lab. I'll just take you through the lab, how it feels inside. Come. This is the state of the art facility lab that we have here, Philips Azurion 7 machine. And what happens is when the patient comes with the chest pain, usually the patient is put on this table and there is a gantry that puts the radiation from above down, which we will be able to see the image on the screen and see if there is a block or not. When we do the angiogram, this is where we will get to know how things are there inside the heart and how bad the disease is. And for having this setup, all we have, this is not just a standalone setup we need to have, because it's an emergency thing that's happening. We need to have every emergency backup that is needed when the patient arrests inside. When the patient gets arrested on table, we might have to ventilate him in the emergency. In that case, for tubing him inside, we'll have the emergency kits here. And if the heart stops suddenly, what happens inside cath lab is not all people will be stable. Suddenly heart rate might drop significantly, drop down to 0, or it might fibrillate to around 700 to 800. So when it fibrillates and seizures, so heart seizures, we have something called as defibrillator, where you would have seen in the movies the patient being shocked and revived back. So this is one kind of a machine where we are using that for. And we'll have all kind of emergency medications here, something called as adrenaline and other things when heartbeat drops significantly, to give it and resuscitate on an emergency basis. This is called power injector, where we use this in certain situation to see the extent of blockage in large vessels such as aorta, where the blood is being carried from heart to other parts of body. This is the power injector that we'll be using to see. And this is called as a IABP machine, intra-aortic balloon pulsation. So supposing the patients with the heart attack have a very low blood pressure, a part of heart beating will be done by this and displaces the blood flow when the heart is resting and takes over the functions partially. So this is one such machine where it is being used on patients. Thank you.